Hello, my name is Tiffany Grant, and I am running for Indiana House District 60. Experience with persons with intellectual and developmental disabilities really doesn't extend past the classroom. So I do work in inclusion classrooms at the high school with students with different cognitive disabilities. So for me, it's always been about creating that equitable, inclusive space where everyone can access the materials, access the skills, and then be able to succeed with their peers. I think the same could be done or should be done in the community. My experience with people is knowing that everyone wants to understand that their identity and their purpose as it relates to a community. They want to have their own space that is respected and appreciated in the midst of everyone else. And so it's really important that we provide communities that give everyone those access points to be real valued members of a community. The direct support professional is an incredibly important position to provide those equitable access points for people with disabilities. In order to provide a sustained, low turnover staff for that direct support professional in Indiana, I would recommend two things. One is increasing that level of pay. We need people to be equitably compensated for the hard work, the hard, high stress positions they are taking. So we need them to be paid fairly. That will probably include increasing the budget for Medicaid, but that's the first thing that needs to happen. And then second, I would like to see some benefits provided to those professionals. Much like teachers who are trying to pay off student loans, they're able to get some loan forgiveness. I would like to see that be an applied benefit for direct support professionals and others who are working in these high demand professions. I think that will help us retain the best people for those jobs. Employment for so many people is about building a purpose and a role for themselves within community with others. So I, as a member of the community, feel like I contribute because I work in the school and I teach children and I provide that service to others. Everyone deserves to have that opportunity to feel like they contribute to the community. And so with a 70% unemployment rate, we are keeping a lot of people, so many people, from contributing in that way to society and to their communities. So I would see two really valuable pieces that would help bring that rate down. The first one is to provide reliable and safe transportation. If we could increase that piece to people with disabilities, we could get them to the jobs that they are qualified for, that they want to work in. So I think transportation is a big part. The other piece is those service providers. So we need to help get more people working with the people with disabilities to get them in those positions and help them maintain those positions. I would fully support funding vocational rehabilitation so that every single person who seeks an opportunity to contribute to society in a meaningful way for them would have that opportunity. One thing that became painfully obvious during the COVID-19 pandemic, as we're still experiencing, is that those who were struggling to begin with, those who were struggling back last fall, so a year ago, were the absolute hardest hit through the pandemic. So when you talk about people with disabilities, or you talk about people who struggled to find work to begin with, people who struggled to stay healthy, to have access to medicine or medical care, that same group of people, those same people are struggling even more now that we are in a pandemic. Like, they were the hardest hit. And so one of the very first things I want to do when I get into office is really reassess the budget for those needs, especially healthcare. We need to make sure that we are expanding access to affordable healthcare, and that includes Medicaid. We need to make sure that those Hoosiers who are dependent on Medicaid are getting the services they need. That is what it means to really respect and understand each other and support one another in society and in community, and we need to do that. So that's one of my very first things for everybody, but in particular, people with disabilities who do need that lifeline of Medicaid provided services. We want to make sure that continues. We don't see any gaps in that service. Part of just that economic recovery that Indiana needs to go through is providing that healthcare. It's providing those job services, and that is absolutely the number one priority we need to work on when we get into this budget year in 2021.